Hi, I'm Sam. I'm with Nova's DPT program. Is it okay if we do some palpations on your arm today?
Yes,
Is it okay if we film it so that I can show my classmates and my professor?
absolutely.
Okay, so let's get started. The first structure that we are going to find are the three heads of the deltoid. The first head is attached to the lateral clavicle, so we're going to palpate that going down, and we will test this muscle by having the patient lift their arm up and applying some pressure as try to resist. There we go. The next, you can relax. The next is the middle deltoid. It is attached to the acromion, and we will test this by having the patient push up against our arm. There we go. The last deltoid head is attached to the spine of the scapula. We'll palpate that down, and we will test this by having them push against our hand. There we go. All three of the deltoid heads attach down at the deltoid tuberosity, and we can find that by having them abduct their arm and follow the muscles down to right here where we find that the tension goes away, have them relax, and we can palpate up. There we go. Come back to the middle. The next thing that we'll be finding is the greater tubercle. So you come inferior and lateral about an inch from the acromion and have the patient in the position as if they're going to shake your hand. That protuberance right there is the greater tubercle. If they go out a little bit, that groove is the intertubercle groove, and then go out a little bit more and you'll find the lesser tubercle. The next portion that we'll be finding is the olecranon. It is right here. It is at the distal end of the humerus, and it is the proximal end of the ulna that articulates with the humerus. From there, we'll move laterally and find the lateral epicondyle. From there, we'll move a little laterally as well and find the humoradial joint. And if we have them rotate their forearm, we'll feel the radial head moving. From the olecranon, we can find the medial epicondyle, and in that groove is the ulnar nerve. If the patient extends their elbow all the way, that area is gone, and you can no longer palpate the nerve. You want to be careful palpating the nerve. If you apply too much pressure, their fingers will go tingling. The last thing that we'll be finding is the brachial artery. So we'll be finding that by palpating the biceps tendon and the cubital fossa. And you'll bring the fingers a little medially, and you should feel it pulsing in your fingers right there.